Yeah.
Um,
What's his favorite superhero?
Superman.
Superman. Okay.
Superman.
Well, he should like Iron Man.
Yes.
So, yeah. So that no, I completely understand. And Superman's pretty cool because he can fly. So,
Yeah.
so, um, so yeah. I mean, so, other than that, I mean, he's a normal kid. I mean, he has conditions, but he's a normal kid, right?
For the most part, yeah. Hmm.
And that's the only child that you have that has a congenital anomaly, right?
Nope. I have 5 children total, 4 of which have congenital anomalies.
Oh my gosh! So tell us about your next child,
MacKenzie,
MacKenzie.
she is 6. She'll be 7 in December. She was born with a level 3 murmur. She had an ASD and a VSD,
Okay,
which
what is
is
it? What is an
aortal
ASD?
aortal septic aortal septal defect,
Okay,
which is a hole in the top portion of your heart.
she had a
And
hole in
then
her
she
heart.
also had the accompanying, yeah, in the top portion.
Okay,
And the VSD, which is ventricular septal defect, which is a hole in the bottom portion of the heart.
so an ASD and a VSD. VSD meaning the ventricle, right, and the lower one, and ASD is the aorta, all right,
Yes,
or arterial septal defect. Which so more than likely, what you're saying is there was two specific holes in her heart, and
correct.
now did that require any surgeries or anything like that?
Well, we went to a pediatric cardiologist, and his initial plan, we had echoes every 3 months, and her murmur was so bad that you could actually put your hand on her heart, and you could actually palpate her murmur.
Wow.
And his recommendation, um, he said most kids are born, with that defect are born with either one or the other, not both. And with her being born with both, the surgery was going to be a little more risky. So he wanted to give her the first year of life to see if they would close. And last December, right before she turned 6, we got the news they had closed completely.
Wow.
We go back this December for one last echo, and if they stay closed, then the idea presumably is that they're gone.
Wow.
And other than that, she's a normal 6-year-old.
It's amazing how the body heals itself in some cases, and
Yes, sir.
and informs itself in some cases as well. But all right, so there's two of your children.
Yep.
Tell me, you see, let me guess, Quinten. Is that
Yes.
correct? Tell me about
That's right.
Quinten.
Quinten, all 5 of my kids were scheduled C-sections. He was born at 38 weeks. Everything was fine. They took him to the nursery and, getting that first initial checkup. And 20 minutes after he was born, his heart rate shot to 286 beats a minute.
Wow.
And which most people know that's severe tachycardia. And had to be put on an adenosine drip to control it. And within, I want to say, probably 24 hours, we had the news he was born with Wolff-Parkinson-White syndrome.
Okay. And what
And
is that exactly?
from what I'm not sure that I explained it right, but the way I understand it is you have a synovial node in the top portion of your heart that fires the beat that they carried it through all 4 chambers.
Okay.
And he had a second one.
Okay.
And it decided it didn't fire all the time, so sometimes he had a perfectly normal heartbeat. But when it did, you could see, heart rates between 250 and 300 within a matter of seconds.
Wow.
He was on medicine for the first year of life. He took propranolol 4 times a day to keep his heart rate slow. And we started seeing less of a pattern on his EKG. The pattern didn't go away, but we saw less of a pattern, so we backed off the medicine. And then this past February, the pattern strengthened again, and he was having a lot of problems, a lot of pain in his chest, and we started seeing rising heart rate again. And we put him back on medicine, but because of the severity of his asthma, the medication is either one of the medications that is used to treat it is counterindicated in kids with asthma.
Wow.
So then his asthma flared extremely badly, and wound up we had an emergency catheterization and ablation done in July. And we just went back 3 weeks ago and got a clear EKG for the first time in his life. And 3 weeks after he had his ablation, he also had an inguinal hernia repaired. So we're hoping, other than the asthma now, we're hoping he's pretty good. We're also looking for a doctor. He's showing a lot of signs for autism. And currently where we're at, there's not a doctor that is accepting of his insurance that will help us with that.
Oh, wow. Okay. Now, so in where the area that you live in, you're saying that the doctor... Now, what's the closest major city? San Antonio?
We live in between San Antonio and Austin.
Okay. Okay. And so either one, Austin or San Antonio, would work for you, right?
Right. Medicaid panels are either full or they don't accept his particular insurance.
Okay. Okay.
And right now, we don't have the money to pay for it out of pocket. So.
Yeah. No. Well, cost for healthcare is very, very expensive. I mean.
They told us the initial evaluations could be between $1,200 and $1,800 for just the testing itself. That's not including getting any kind of reports or any kind of treatment plans or anything like that.
Yeah, yeah. Well, I can tell you, even with private insurance, it's you still have a lot of co-pays and everything else and out of pockets that people don't realize, and I mean it's expensive. It's very expensive to do things. So. Okay, so tell me about Bryton. That Bryton is your, let's see, how old is he? He's 4?
He just turned 3.
Okay, all right. So tell me about Bryton.
Bryton was born with, it's called type C, tracheoesophageal fistula, and esophageal atresia. The top part of his esophagus pocketed off, it didn't connect, and the bottom part of his esophagus went directly into his airway.
So wait, so Spencer had a fistula.
Correct.
That was the H type.
Correct.
And this is the C type. Is that correct?
Yes.
So how rare is the C type?
The C type is actually the most common.
Okay. Okay, but it still affects like 1 in 4,000 kids. Is that right?
One in about 4,000 to 5,000 children. Yes.
Wow. Wow. And
the H type is 1 in about, depending on who you talk to, between 10 and 30,000.
Yeah. Yeah. But still, I mean, 30,000 people in billions of the world. I mean, that's still a pretty large amount. So.
And the fact that we have two children with tracheoesophageal fistulas is almost unheard of.
Now, because it's not obviously hereditary or genetics, right?
Nothing they have found so far. There is one test left out there to do that is still currently in research testing. It's the whole exome genome testing, and because it's still a research study, Medicaid doesn't cover it. And that's our only genetic testing left to do to find out. Other than that, all other genetic testing has come back negative.
Wow.
To show any kind of hereditary on any of the 4 kids.
So, how many surgeries has Bryton had?
Bryton's on number 6, and number 7 should be next Friday, provided his blood count works out.
Oh, wow, that's amazing. Just having to go through all the surgeries, and I mean, you obviously know our story and and what we went through, and the 3 surgeries we had with Shawn, and I know personally how devastating it was, just during that year. But I mean, this for you, it's constant. This is something that happens every day. You know, it's something new. It's something you have to focus on. It's treatments that you have to do. I mean, it's pretty amazing.
It's overwhelming.
So
honestly, and even from a day-to-day basis, even for me, I mean, I know it, I expect it, but it's still very overwhelming. It's still. I guess the biggest thing I have a hard time with is knowing that there's nothing I can do. I mean, I've taken him as far as Boston to the best surgeon there is for the TE fistula. You know, we're currently in Texas travel between San Antonio, Houston, and Dallas for treatment.
Yeah.
And it's very overwhelming. It's very hard on our family.
So
For more information about the journey, go to Shawn'sIronman.com.